One of the biggest fears athletes have is re-injury. How does sports PT approach return to play differently? To start, sports PT addresses it for sure. General PT, I'd be willing to bet that you don't always get return to sport guidance. Like their strength testing by hand might be the deciding factor for some PTs. And look, that's not to rag on those PTs. It literally might be the best they can do. They might not have any devices to objectively measure strength besides their hands, and that's not their fault. And they may not have the training or knowledge for return to sport. So strength testing is the best of their knowledge, and they're doing their best. But I mean, that's exactly the difference. Sports PT should be able to more objectively assess strength measurements, should have the knowledge of progressions back in the sport, should be able to test readiness for sport. My answer to this question is that sports PT has an approach where general PT doesn't always. On episode 21 of this podcast with Logan Crowell, he outlined his return to play when he was in high school. They never did anything more than light side shuffling on a treadmill with him. And then on his last day, they told him to sprint down a hallway and cut off of his injured leg. And that was it. That ain't it. That's not how things should be done. Especially when you're trying to prepare athletes to go back onto the field, withstand a whole bunch of demands and forces. And that's the testing that prepares them for it. That's just falling short of the mark. Question 14, what does clearance actually mean in sports PT, and why is it often misunderstood? This one's dangerous, very dangerous, because clearance means different things to different professions and different people. For example, ortho docs will clear based on patient reports and the reports they get from the patient's physical therapist. Some physical therapists will clear based on some things that I already discussed. Sometimes clearance looks like insurance not paying for any more PT, so they're forced to be done, and therefore they're cleared. For me, in the most simplest explanation I can give, I want to see full and equal strength, left versus right. I want there to be no pain. I want equal jump tests, hop tests, and power dynamics. I want a baseline of chronic workload to be established. I want there to be an on-field practice progression, and I want full reintegration to team practice before clearing them to play in a game. As an athletic trainer, speaking on the athletic training side of things, for me, that's not what happens. Kids will go back from injury early with the understanding that the goal is to allow them to play during the season. But in the postseason or after their season's done, they should be addressing all of these things that we didn't clean up during the season. If I held every athlete to that standard, then most of them would be missing the entire season, and that's not what most of them are there for. But if I'm working with someone on the sports PT side who has real goals or real life stuff at stake, then that's the criteria that they should be meeting for me, because that's what makes the process a success.